Good afternoon. I'm Marla O'Keefe. Welcome to the workshop, Thriving, Not Just Surviving After Transplant Through Exercise and Fatigue Management. It is my pleasure to introduce our speakers, Mr. Karthik Jayaraman and Ms. Bonnie Lucio. Mr. Jayaraman is the Center Manager at Baylor Scott & White Institute for Rehabilitation in Dallas, where he focuses on multidisciplinary outpatient rehabilitation of oncology patients. Mr. Jayaraman and his colleagues have worked with the BMT team to develop a prehabilitation protocol for all patients scheduled to undergo a transplant to help maximize function and survivorship. Bonnie Lucio is a physical therapist and board certified in oncologic physical therapy at the Baylor Scott & White Institute for Rehabilitation in Dallas. She has been working as a physical therapist for the stem cell patient population for the past 30 years. For the past 11 years, she has been working in the outpatient setting and enjoys seeing patients prior to and after transplant to improve their quality of life. Mr. Jayaraman and Ms. Lucio have created a video for you about managing fatigue and building endurance. It includes demonstrations on a number of exercises you can do to help you thrive after transplant. Please note that these are for demonstration only. You should consult with your doctor before beginning any exercise program. We'll now begin by watching the video, after which Mr. Jayaraman and Ms. Lucio will be available to answer questions.
Hi, my name is Bonnie Lucio. I'm a physical therapist at Baylor Scott & White Institute for Rehabilitation in Dallas, Texas, where I work with stem cell transplant recipients. With me is Karthik Jayaraman, Center Manager for Outpatient Rehabilitation at the Institute, who also works with stem cell transplant recipients. We're going to talk with you about ways to minimize fatigue after transplant and demonstrate some exercises that can build stamina and strength. At the conclusion of the workshop, attendees should have a clear understanding of the following: how an exercise program can increase stamina and strength, how a physical therapist can tailor an exercise program to address an individual's needs, specific exercises recovering patients can perform at home to increase stamina and strength, and the role of other factors such as nutrition and energy conservation in managing fatigue. The National Comprehensive Cancer Network defines fatigue as a distressing, persistent, subjective sense of tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity and interferes with usual functioning. Fatigue is by far the most common and for many the most distressing symptom. People describe fatigue in many different ways. It can affect us both mentally and physically. They describe it as weakness, exhaustion, lack of energy or no energy. They feel drained, and they have difficulty concentrating. You can also rate your fatigue. Fatigue can be rated on a 0 to 10 scale, similar to the pain scale, with 1 to 3 being mild fatigue, 4 to 6 being moderate fatigue, which many people have at least moderate fatigue during and soon after treatment. 7 to 10 is extreme fatigue, and 10 is the worst fatigue. It can be helpful for the healthcare team, to keep a diary and track your fatigue and report these symptoms so that they can better help manage them. There's many causes of the fatigue. Treatment and medication side effects. Some medications make it hard to stay awake, and some make people wired and they have trouble going to sleep. So timing can make a big difference. Nutrition problems and dehydration, stress, pain, anemia, sleep changes, and underlying medical issues can also cause problems. Karthik's going to go into more details in this area. Cancer-related fatigue is experienced by 70 to 100% of cancer patients while receiving chemotherapy. It may continue to be disruptive in healing for months or even years after the treatment ends. It can often take twice as long to get your strength back as it does to lose it, so be patient with yourself. Fatigue can also cause a patient not to continue with treatment. When people's bodies get too weak, they can't tolerate medications as well. Adequate nutrition also plays an essential role in fighting cancer and its recovery. This can be affected by mouth sores, nausea, vomiting, or foods just not taste like they used to. Patients who adequately nourish generally tolerate treatment better and recover faster. Ask your healthcare team for a consult with a registered dietitian to develop an individualized plan that meets your needs, and your body needs fuel in order to perform properly. The average adult, dehydration is also an issue. The average adult needs 10 ounces of liquid for every 50 pounds of body weight. Most of us should drink between 2 and 3 quarts of water per day. It's especially important to increase water intake during active treatment to avoid fatigue. Drink that water. Keep water available and hydrate during the day and throughout exercise. Mental and emotional stress can also cause a problem. Treatment for cancer can be an emotional roller coaster. Hormonal changes, mood swings, and disruption of sleep can all contribute to fatigue. Relaxation techniques and physical activity may help balance these things out. Some suggestions: supportive and expressive therapies like support groups, counseling, journaling, and diaries. And there's a lot of complementary techniques that can be very helpful as well, like breath control, progressive muscle relaxation, guided imagery, massage, yoga, and Tai Chi. These things are going to be discussed at a later presentation in more detail.
Another common cause of fatigue is pain, and this is something pretty much all of our patients deal with at some point along their cancer continuum. When you have increased fatigue, it can cause changes in your hormonal levels and lower your threshold for pain perception. So this is really important to communicate with your healthcare provider if you're noticing changes in your pain levels, and some of these suggestions below are things that can really help to track your pain and then manage it effectively. Another common cause of fatigue is the medications that you'll be receiving as part of your treatment. Almost all of these medications will contribute to the feelings of fatigue that you experience. And a lot of the drugs that combat nausea that you'll be feeling during your treatment can also cause sleepiness. So it's really important to discuss with your healthcare team and your doctors if you have any questions about adjusting your medications, just to ensure that you are not making changes on your own. So please communicate with your team as much as you can, and as your timing of your dosage can really make an effect on your side effects. Another common cause of fatigue is anemia, and anemia is basically when your body has too few red blood cells, and so when that happens, it has to work a lot harder to supply oxygen to your muscles. So a simple activity like climbing stairs can feel like climbing a mountain. So the importance of muscular conditioning is vital here. A fit muscle uses less energy and oxygen to get the job done. So we can really come in and help as healthcare providers and therapists, because we can work with you based off of your individual lab values to create a safe exercise program. So we often ask our patients to provide us with their current lab values if they're available during their treatment and even after transplant, to make sure that we are exercising at a safe level. Another common cause of fatigue is poor sleep. This is pretty straightforward, but 4 out of 5 patients have trouble sleeping. And I would say pretty much every patient that I've treated along their cancer continuum is dealing with sleep disturbance to some degree. So it's really important to be managing this on a daily basis and trying to talk with your healthcare providers on different strategies to help manage this effectively. So some of these suggestions below, especially in our day and age with reducing screen time and using phones, laptops, tablets before bed, and just reducing stimulation, can be really effective in this. Another important thing to combat fatigue is energy conservation. So I often recommend patients to keep a journal or a log of their daily fatigue, especially during active treatment, as this might help them to plan their activities around when they're feeling more energized. The other thing that's important is to just break your tasks into parts. So if you're doing something like laundry, working on moving things into the washer first, taking a break before you then move things from the dryer. And participate in meaningful activities when you have that energy or you're feeling more energized. This can be really helpful. And of course, allowing those around you to help and provide support when they're able to. Another area where we can combat fatigue is working with a physical or occupational therapist. So this is where we can really come in. We can play a role in evaluating your specific needs and determining a plan that helps you throughout your survivorship. So please remember that wherever you are in your cancer continuum, whether it's active treatment or post-treatment, we can play a role in helping to manage that fatigue and then maximize your function. So these are some of the areas that we consider when we're evaluating our patients, and there's a lot more that goes into this, but the main takeaway here is that a lot of patients after transplant may think that they have to live with some of the symptoms that they're dealing with, whereas we can really manage these and reduce some of the deficits that you're dealing with. Along those same lines, exercise is another way to combat fatigue, and although it might be counterintuitive, exercise can really help fight fatigue, especially during active treatment. And so we want to be able to, again, create a plan that fits your specific needs and allows you to be as active as possible in a safe manner. So we really would really prefer you all to meet with a skilled therapist to help manage this appropriately and create a program that fits your specific situation. In terms of how much exercise or how often you should be exercising, the general recommendations from the American College of Sports Medicine are the same for cancer survivors as they are for healthy individuals. And that consists of 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity. Now, this is something that we would want to work up to. That may not be something that you're able to do at this moment, but hopefully with working along with a therapist, you could, eventually get to that point. The other portion of that would be 2 to 3 non-consecutive days per week of resistance training and flexibility training. The flexibility portion will be very important for our bone marrow transplant recipients, especially in light of graft versus host disease. So we will really make sure we incorporate some of those exercises into your individualized program. And then some of the suggestions below are general recommendations that we recommend for most people, but very important to include a warm-up or cool-down and basically as much activity as possible that we can get out of you as you're going through your treatment and even after. Overall, I think the main takeaway is that we want you to be communicating with your healthcare team whenever you're noticing changes in how you're feeling as you're going through your treatment or even after your treatment, because we can really help to develop an individualized plan that can help maximize your function. We want you to be pacing yourself and listening to your body so you can set appropriate limits and priorities. And this overall outline is just an exercise recommendation for our patients. It has these components that you see here. And overall, the big thing that I've mentioned many times is whenever starting a new exercise program, you want to be consulting your healthcare providers because we need to develop a program that is specific to what you have currently going on. We will be demonstrating some of these components, and you can follow along with the handouts that we've provided.
This stretch is a standing quad stretch. So Karthik's going to put his leg up on a chair or a table behind, and he needs to, very important to stand up nice and straight because you're stretching your quadricep muscle right in the front of your leg. And again, you're going to hold this stretch for 15 to 30 seconds. One thing that people have a tendency to do is have their leg kind of out to the side a little bit and not drop down, and then they're not getting a good stretch. You can also, if you can tolerate it, you can grab the back of your leg and get a really good stretch like this. And again, he corrected himself and he dropped right back down like this. So let's go ahead and stretch the other side. Same thing, stand up nice and tall because that quadricep muscle attaches on your pelvis. And so if you stand up tall, you're going to get a better stretch. Very good. Thank you. This exercise is the seated hamstring stretch. The picture shows doing it on a physio ball, but you can also sit in a chair like Karthik is here. So what you want to do is put your legs straight forward, and you want to hinge at your hips, and you want to bring your chest toward your knee, and you want to hold this stretch for 15 to 30 seconds. A tendency that people have is to round their shoulders like this, but you're not getting a good stretch on your hamstrings, so you want to sit up nice and straight and hinge at your hips. And you want to also make sure that you stretch on both sides. So sit up nice and straight and lean forward. Hold it, and then relax. The next stretch is the runner stretch or gastroc stretch. You're going to have either a chair or a wall or something in front of you, and you're going to put one of your legs straight back. Make sure that your heel is touching the ground and that your foot is pointing straight forward. You want to stand up tall and you want to lean into the stretch. Keep your back leg straight. And again, hold it for 15 to 30 seconds. Okay, let's do the other side now. Stand up tall, heel touching, and lean in. Good job. The next exercise is lower trunk rotation. So you're going to lie down with your knees bent. And I like to have people have their arms out to the side at a 90-degree angle because it gets a good stretch all the way along your side. What you're going to do is bring your knees over to the right, just like Karthik's doing. You're going to get a good stretch all along the side here and in your low back. And you're going to hold it for 15 to 30 seconds. And then you're going to come and go the other direction. Notice how he's keeping the top part of his body flat against the table. The next stretch is the butterfly stretch. You're going to be sitting on a firm surface with your feet together like Karthik has them. If you can bring them a little bit closer, you can see that Karthik's a little tight here. So you want to make sure that you're sitting up nice and straight and that your shoulders are not rounded. And if you can, you want to hinge at your hips and come forward and get a really good stretch. If you need a little bit of extra stretch, you can use your elbows and push in here and get a little bit more of a stretch. Again, 15 to 30 seconds. You'll feel that on the inner thigh area. The next stretch is a unilateral pec stretch. So you're going to find a corner of a wall and you're going to put your hand up here. And what you're going to do is you're going to stand up nice and straight and you're going to lean in. And if you can bring your shoulder back a little bit and get a good stretch on that pec muscle on the left side there. 15 to 30 seconds. You'll want to make sure that you do both sides, and you can also, in a corner, do both sides at the same time if you'd like. That's another variation. Okay, be sure to do the other side as well. So go ahead and put your arm up and lean in. Stand up straight. Good posture is very important. The next stretch is the tricep stretch. So you're going to reach your hand back like you're scratching your back. You're going to take your other hand and you're going to pull it back so that you get a good stretch. It's very important on this exercise that you don't arch your back. If you need to stand with your back to the wall to keep you from arching, because you want the stretch to be in this tricep muscle right here. Okay, let's go ahead and stretch the other side. And hold it for 15 to 30 seconds. He's doing a good job of standing up nice and straight and having good posture. This next exercise is a transversus abdominis exercise. So you're going to lie down with your knees bent, and I want you to go, you can put your hands right over here, and you're going to make sure that you can feel those abdominal muscles coming into your fingers. So what you're going to do is you're going to tighten your stomach, and you're going to try to bring your belly button toward your spine and rotate your hip a little bit back toward the mat. And you're going to hold it for about 15 seconds, and then relax. You should be able to feel those muscles coming into your fingers there. These are muscles that we frequently don't use on a day-to-day basis, so we have to sometimes teach them how to respond. Good job. Okay. So this exercise, you're going to incorporate some marching with your abdominal tightening, bracing exercise. So go ahead and tighten up your abdominal muscles, and you bring one knee up to about 90 degrees, and then slowly bring it back down. Now you're going to bring the other knee up, and slowly bring it back down, and then you're going to relax your contraction between each one. Okay, tighten your abdominals, knee up, down, the other knee up, down, and relax. You can make this a little bit more challenging by tightening up your abdominal muscles, bringing your knee up, keeping it there, bringing the other knee up, bring one down, the other one down, and then relax. The next exercise is bridging. So Karthik's going to tighten up his abdominal muscles, and he's going to lift his bottom up, and then gradually slowly bring it back down, and then relax. Okay? Tighten up your abdominals, lift up, back down, and relax. So you can also tighten your gluteal muscles at the same time while you're lifting your bottom up off the mat. And back down, and rest.
This next exercise is a standing hip abduction exercise. So we're going to be working the lateral muscles of the hip. Bonnie is going to be standing nice and tall with a chair next to her for balance support, and she's slowly going to move that leg out to the side and in. We'll go ahead and do this on the other side too. Some important things to think about is we want to make sure she's not leaning to one side as she's bringing the leg out, but she's staying nice and tall and slowly moving that leg out and slowly moving that leg back in. She's doing a good job of maintaining her posture while she moves here. This next exercise is a standing hamstring curl. So we're going to be working this muscle right here in the posterior thigh. So what Bonnie is going to be doing is standing nice and tall with the chair in front of her with her toe pointed behind her, slowly bending her knee up and slowly bringing it back down to the ground. She's doing a good job of staying nice and tall with her posture and not leaning forward as she lifts the leg and lowers the leg. Okay, let's go ahead and switch sides. The other thing to think about when you're doing this exercise is you want to make sure that your thigh is not coming too far forward as you bend your knee up. That's a common substitution that we see here. So Bonnie's doing a good job of keeping her knees aligned together as she lifts and lowers that knee. Good. The next exercise we're going to be doing is a standing march with support. So Bonnie is going to be standing nice and tall with a chair for balance and slowly lifting up one hip to about a 90-degree angle to her trunk and coming back down. We're working the front part of the hip flexor muscles with this exercise, and we're also getting some balance involved in this exercise. So the more support she uses through that chair, or the less support, the more she could challenge her balance. And you see she's going nice and slow and controlled with her lifting and lowering of the leg. She's also staying up nice and tall with her posture. This next exercise is called a sit-to-stand exercise. It's a very functional activity that we all have to do throughout the day. So the first thing Bonnie's going to do is scoot forward in her chair. This will help her get her momentum a little bit more forward. And what she's basically going to do is try and bring her body weight forward without using her hands to come to a standing position. And she's doing a good job of keeping nice and tall posture with her back and slowly controlling on the way back down. If you're unable to do this without using your hands, you can always cross them out in front, or if you need to push from the chair to give you a little bit more support, you may. But we often have to get up from low surfaces throughout the day, whether it's a low toilet seat or a low soft couch. So this is an important exercise to practice to help those activities be a little bit easier during your day-to-day activities. This next exercise is a step up with support. So Bonnie is basically going to bring one foot up to the step and slowly step up to that step and slowly come back down. Now she's got a chair right next to her for support. And if you can do this at home, you know, if you've got a stairs or steps with a railing that you can use for support next to you. And so this is a really important exercise for the front of those thigh muscles, your quadriceps, your hamstring muscles, and your glutes. And this is something we all have to do throughout the day, often being able to safely navigate stairs and steps. The next exercise we're going to be doing here is a shoulder flexion exercise, focused on the front part of the shoulder muscle here, your deltoid muscle. And you can use dumbbells here or resistance bands as shown in the handout. So what Bonnie's going to do is start with one arm, raise it straight up forward to about shoulder height and slowly lower it back down. It's really important to try and keep your elbows straight when you're doing this exercise so that the front of that shoulder muscle, that deltoid muscle, gets the majority of the work. A common error we see when people do this is they want to bend at that elbow or bend forward at their trunk. And so you really want to think about staying up nice and tall, keeping your elbow straight, and controlling that weight up and down as you move through this exercise. Good. The next exercise we're going to be doing is a bent over row. So what Bonnie's going to do is slowly hinge forward at her hips, maintaining good back posture. She's going to start with those dumbbells out in front, and she's slowly going to row those dumbbells up and squeeze her shoulder blade muscles together. So the purpose of this exercise is to target these muscles right here in the middle of her shoulder blade and her back. And she's doing a nice job of maintaining good posture, keeping those shoulder blades squeezed as she lifts and lower. Perfect, just like that. This next exercise is called scaption, and it's basically working some of the lateral shoulder muscles here. It's a very functional activity that we often have to do when we're reaching and grabbing things from cabinets in the kitchen or up overhead. So what Bonnie's going to do is stand tall with her arms by her side, slowly lift up, almost making a V shape with her arms, and slowly coming back down. Again, it's really important for her to try and keep those elbows straight as she's raising those dumbbells up and slowly coming back down, maintaining good tall posture as she moves as well. Perfect. This next exercise is called a tricep kickback. So we're going to be working this tricep muscle right here in the back of the arm. Bonnie is going to use a chair in front of her and slowly bend forward at the waist. She's going to start with that arm by her side and just move at the elbow to straighten that elbow back and slowly come forward, working this muscle right here. Now you see she's doing a good job of not moving her whole arm, but just at the elbow to isolate that muscle. Good, and let's switch sides. Same thing here. She's coming back nice and slow, keeping that elbow as the only piece moving and the shoulder nice and steady. Good. All right, the last exercise here is a bicep curl. So Bonnie's going to start with her arms by her side, palms opened up, and she's slowly going to curl those weights up and slowly lower back down. The big substitution that we often see with this is people wanting to really rock and use momentum to bring those weights up. So you really want to find a weight that allows you to maintain good posture with your back and slowly lift and lower as she's doing here. Perfect. We hope these demonstrations of these exercises were helpful for you all as you move along your cancer continuum. And just please remember that if you are looking to start an exercise program, that you meet with your healthcare providers and try to get with a physical or occupational therapist to help design an exercise program that meets all of your needs.
Thank you. Thank you, Karthik and Bonnie. That was an excellent presentation. We will now take questions. As a reminder, if you have a question, please type it into the chat box on the lower left-hand corner of the screen. Our first question I'll throw out to Bonnie. What is the difference between physiotherapy and occupational physiotherapy?
Okay, sure. Yeah, so quickly, occupational therapy refers more to activities of daily living. So a lot of activities like trying to get dressed, bathing, things that you need to do for your self-care around the home. Whereas physiotherapy or physical therapy is a little bit more about more exercise-based or functional-based tasks. So whether that's trying to, get stronger to get, around the home, to get back to work, exercise-specific things of that nature. So that's the kind of the very broad difference between the two of those different categories of physical and occupational therapy.
Thank you. Bonnie, I'll throw this one to you.
Okay.
This person has some problems with extreme morning tiredness. I often ask my parents to drive my daughter to school, but I would like to be able to do it myself. What can I do?
Well, I would wonder what kind of sleep this person is getting, because if you're waking up tired, then the sleep is probably not very restful. So I would look at making sure that you're getting a good amount of sleep. And again, that some of that exercise will help you sleep better at night as well.
Okay, thank you. And just so you know, we do have a workshop on managing sleep challenges after transplant on Tuesday at 1:30. So maybe that'll help also. Next question is, have you heard of classical stretch eccentrics with Miranda Esmonda White? Occasionally on PBS. I'm noticing some similarities between some of the exercises they do with some of what you have been demonstrating. Karthik or Bonnie, either one of you?
I haven't heard of that specific program, but a lot of these exercises that we've given are fairly common exercises for patients that are post-bone marrow transplant and just our general oncology population. I mean, a big focus that we tried to target here is improving flexibility because that's a very common problem for our patients post-transplant. So that was one of the reasons why we tried to include quite a bit of upper and lower body flexibility exercises.
Okay, thank you. Next question, is it healthy to push myself to do things when I'm tired? I worry that it will result into a relapse. However, I would like to do things like taking care of my daughter instead of often asking for help. Bonnie?
I think the key here is to pace yourself and try to increase the activity gradually. Like the slide talked about earlier, the fact that you need to save your energy to do the things that you enjoy. And so you can do some energy conservation techniques while you're, bathing, showering, doing those type of things so that you can have the energy to take your daughter to school or wherever. So I think pacing is the big key.
Okay. Next question. Are the exercises the same for before and after cancer treatments? My treatment ended in November of 2021. Karthik?
Yes, we definitely tend to give this similar program to our patients pre and post transplant. I think the biggest thing that will determine whether they're appropriate for you individually, of course, is talking with your healthcare team, your physicians, and just determining what you can tolerate. I mean, really our goal with pre and post transplant is to get patients to be as active as they can be in a safe way. So, some things might just be too challenging, and if they are, that might not be appropriate for you. So that's where, we put that disclaimer. Please be in close contact with your team and provider to make sure what you are doing from an exercise standpoint is appropriate for you individually based on where you're at in your treatment survivorship.
Thank you. Do you suggest these exercises all be done on the same day or different muscle groups on different days? Bonnie?
Well, a lot of the stretching can be done every day, but usually as far as the strengthening exercises, you can spread those out and possibly work more on your upper body and core, say, one day, and your lower body another day. So it just depends on really your tolerance, and the aerobic component is also important. So doing things like walking or a stationary exercise bike and those types of things as well.
Okay, thank you. This person wants to know if chair yoga that they do sometimes is an appropriate form of exercise?
Yeah, absolutely. I mean, flexibility, like we mentioned before in the program, is a really important part for our bone marrow transplant patients. So any yoga, chair yoga, any modifications to yoga, the deep breathing component is also wonderful because it helps to kind of calm the system down. And that can be very helpful from a stress standpoint and managing fatigue as well. So we are a big fan of yoga, chair yoga, anything along those lines.
Great, thank you. This next question is, I suppose with cancer treatment, using chair and other supports is advisable. However, if the patient is feeling well and okay to balance, does not using a support negate what you're trying to accomplish with certain exercises? Bonnie?
I would say no. Again, we just want to make sure that people are safe while performing their exercises. So if you're safe and you don't need the support, then by all means, go ahead and do that.
Okay, thank you. Can you improvise these exercises that you've shown us when you have lower back and shoulder issues?
Yes, absolutely. I think the big goal with all of this is none of these exercises should be causing pain or discomfort, whether that's the weights that you're using or the positions that you're in. So if you are noticing that if you're doing an exercise, and that's any exercise from that means, make sure you're trying to avoid any painful movement. So absolutely modify in any way you can for it to be more comfortable for you.
Thank you. Do you use myofascial massage for any of your patients with muscle fibrosis?
Yes, we do. We get a lot of patients with chronic graft-versus-host disease, and some myofascial techniques are extremely helpful in helping these patients to be able to get more flexibility and less pain.
Very good. Next question, have you used any exercises for minimizing mouth sclerosis?
I can't say we've used specific exercises for that, but I think the key again would be trying to work on what feels tight and any just normal motion that would allow for more flexibility in that area. But I haven't done any specific things for that, if that answers the question a little bit better.
Thank you. Next question is, how common do you think it is for a patient undergoing treatment to be able to exercise 20 to 60 minutes a day, even if it's interrupted, like 3 sessions of 20 minutes? Is the fatigue, nausea, that inducing of inertia? Let's go with that first part of that question.
Okay.
Go ahead, Bonnie.
Okay. I would say there are some times that patients can tolerate doing that much exercise while they're going through treatment. It's very individualized, though, so it just depends on how the patient feels and how they're tolerating the treatment, how many other side effects like nausea that they're having, because nausea obviously can make it hard to want to exercise, and if you take a lot of anti-nausea medication, sometimes it makes you sleep, so you don't want to get up and exercise in that case. So yes, it is possible, and people may feel great one day, and the next day they may not be able to tolerate as much, so I usually tell people just to do whatever they can that given day to keep their activity level up.
Okay, thank you. Is it better to wait to stretch after my daily walks or do light stretching before walking or before and after? Karthik?
I would say before and after if possible. The more flexibility, the better, especially for our transplant population. If you've got the time, try to incorporate stretching throughout the day. We tried to show you all some seated stretches that even if you're watching TV, you could work in. Having a cup of coffee in the morning or your breakfast. So the more flexibility, the better.
Great, thank you. Is it healthy to push myself to do things when I am tired? I'm worried about relapse. Go ahead.
Oh, yeah. that's a really tough one for people, and that's where it really is helpful to work with a physical or occupational therapist so that we can help guide people through this process, because we need to make sure that their counts are okay and that they're safe to be doing what they're doing. But some days people have to push themselves a little bit, or they'll end up wanting to stay in bed all day. So it's really very individual.
Okay. Next question. What is your advice on increasing muscle for women who are now postmenopausal because of transplant?
So we definitely see a lot of folks in that field. I think a big thing to think about is incorporating some type of strength training in addition to your cardiovascular activity. So light, gentle weight strength training, body weight exercise can also be very good from that standpoint. And making sure you're discussing with your doctor that your bone health is good as well, especially to ensure you're not at risk for fractures. So there's a lot of things to consider there, but definitely having a strength component into your exercise routine would be very important.
Thank you. My oxygen level drops every time I exercise. What do you suggest in order for me to begin to get some muscle tone? It has now been more than 3 years since my transplant, and I have very little mobility.
Well, obviously it's important to maintain a good oxygen saturation. My question would be, how is your breathing, and making sure that, there's techniques like pursed lip breathing that can help people make sure that they're getting the oxygen that they need to their muscles. You can also adjust the position that you do your exercise in. Sometimes people don't have their oxygen saturation drop until they stand up, so you may be able to do some things sitting or some lying down exercises. But I would definitely, want to make sure that it's okay with your medical team to be performing these exercises.
Thank you. Can you either one of you suggest any phone apps that might be helpful?
Is this like, just to clarify, is this like exercise-specific phone apps, or I guess I don't know exactly what they mean by phone apps.
I would say exercise phone apps, yes.
Yeah, Bonnie, I don't know if you have any specific ones that you've used before. There's definitely some for like stretching and flexibility. There's all kinds of exercise apps like Peloton and those things, but those are a little bit more higher level strengthening. So I think to answer the question better, I think I would kind of know more specifically on what the person is wanting to get out of it. I don't know if you have anything else to add, Bonnie.
Well, I know there's also apps for relaxation techniques and things like that that can be real, like one like Calm, or there's a variety of different things that can help people if they need to do meditation or guided imagery or some of those other complementary techniques that can help.
Headspace is a nice app for meditation that I've used that actually has some exercise in it too. I think you do have to pay for it, but I've used it before. It's pretty nice and easy to use. It's called Headspace.
Okay, great. Thank you. Do you think a person undergoing treatment would be able to do part-time remote office-based work?
Well, I would say obviously that's between the person and their employer, but I have found that a lot of patients are able to return to work earlier than they have in the past because of this option of being able to work from home, because they can take the needed rest breaks and not be going into, just getting into and out of the office and driving there and driving home can be stressful and exhausting. So I think it might help people return to work sooner.
Okay, thank you. My leg muscles are wasting due to prednisone. What's more important, more protein intake or more strength training?
That's a very good question, and that's something we see very often in this population. I think I would definitely have to say they're both equally important. Working with a dietitian that can guide you based off of your personalized diet is absolutely important. So I would reach out to your care team to get that established, but also getting on a strength training regimen is also just as important, because we want to be utilizing those muscles and help curb the side effects of the medication that you're on. So I would definitely say both.
Okay, thanks. Is Pilates or yoga good for stretching and low intensity strength?
Yes, they're both very good. There's a lot of Pilates does a lot of flexibility and a lot of core work, which is really important for balance and trying to keep yourself from having back problems and such.
Okay, next, I will throw this one to Karthik. Are there exercise recommendations to help constipation from meds?
Well, exercise in general will help with gut motility. So there's not like I wouldn't say there's a specific exercise per se, but getting good pelvic strength would be important. So in some of the exercises you saw, there was a muscle called your transversus abdominis muscle, which was one of the ones that Bonnie was demonstrating with me as the person exercising, where I was laying on my back. Those are very good pelvic floor strengthening muscles to have established. So any core strengthening would be good, but just exercise in general, cardiovascular and strength training is helpful when you're having any type of GI issues related to your medication.
Thank you.
I would just add to that you've got the dietitian to talk to as well, as far as foods that would help keep you from getting constipated as well.
Okay. I have been trying to slowly lower corticosteroids for my chronic GVHD for the past 2 years, but I feel fatigue when I lower my doses. How do I get my natural cortisol to be produced at healthy levels? Do you have any advice? Karthik?
So this is definitely a question that I would talk to your physician about in terms of doses for your steroids, because they're going to help manage that. Exercise definitely helps with managing stress and, endorphin and cortisol levels. So activity, although it may sound counterintuitive, is one of the best things that you can do when you're dealing with steroid use. It can help really curb a lot of the negative side effects of the medication. Pacing and activity, task management, like Bonnie mentioned earlier, is also very important. But in terms of the actual dosage, I would talk to your doctor about developing a plan that works for you, and then just trying to be as active as you can to help, because that's the best tool.
Thank you. Is 10 ounces of liquid per 50 pounds of weight all you need per day? Does that count just water, or does it include milk, soda, and coffee? Bonnie?
Well, again, I think the dietitian may be able to answer that a little bit more specifically, but I think liquids in general are good to keep people from getting dehydrated. I don't think it necessarily has to be just water.
Okay. Are there any exercises or stretches for neuropathy in the feet?
That's a great question. We see that all the time, and we do a lot of different things for that. Basically any balance exercise or strengthening exercise that requires the muscles of the feet to work and work while you're exercising are going to be good. So any and all standing exercise that we included in the program would be helpful for neuropathy. I would also try and meet with a physical or occupational therapist too, because Bonnie and I do a lot of like kinesiotaping strategies and myofascial release techniques to help reduce neuropathy. And your doctor can help talk to you about, medication. So there's a lot of things that can be involved with neuropathy. It's not something you just have to live with. So I would definitely, reach out to your provider to help manage that.
Thank you. Have you used any exercises for sclerosis in the joints, especially the wrists? Bonnie?
Well, typically if people are having a lot of wrist issues, I would probably refer them to an occupational therapist or a hand therapist to work on that area specifically, but general stretches are good for the flexibility in that case.
Thank you. Are there supplements that are suitable for energy that are not caffeine?
I would defer that to speaking with a dietitian, just because, again, anytime you're taking any supplements, it really does depend on what your individual lab values look like. So I wouldn't want to give like a generalized answer to that. I think that would be something you would want to talk to your doctor and your dietitian about to see where your levels are and if supplements are needed based off of your current lab values.
Okay, thank you. I'm just going to add here, a handful of you have asked about the video exercises and the downloadable handouts being available. They will both be available on the BMT website after the symposium, so you will have access to them shortly when we are done. So that's just a little put in for that. Is there any research about the effectiveness of exercise during the chemo treatment for AML and the chemo of transplant?
Well, there are some research studies about exercise and transplant recipients, but by and large, a lot of the research is in the breast cancer population. It's just an area that's probably been studied more than any other cancer population. But there are some research articles out there.
Okay. I think we are at the end of our questions. If anyone has any other questions, they can chat them in. I'm just taking a quick look here. I will amend my previous statement. The handouts are available for downloading right on this presentation. It says downloadable slides, so you can get them there. So just so you know that. Okay, there is another question. During my 6 cycles of chemo for lymphoma and during my BMT, a mostly daily goal was power walking, was to get my heart rate up to about 110 beats per minute, sustained for between 1 to 4 miles. Can you address any benefits to that part of my exercise? Karthik?
Yeah, so as we mentioned before, I mean, any aerobic or cardiovascular exercise like walking, power walking, bicycling, those are all great things to do. I mean, ideally, as mentioned in the PowerPoint, we really want our patients to be doing some type of aerobic exercise that they can tolerate, that's safe for them, coupled with some type of strength training. So they're both equally important, and we would encourage you to try and, get both of those components into your typical exercise routine if possible.
Thank you. Another question just came in. Is there a way to reverse osteopenia from chemo? Bonnie or Karthik?
Well, I mean, I would say that the exercise will help keep it from getting worse. I don't know that you can always totally reverse it. So I would say the goal primarily is to try to keep it from worsening.
Okay. Well, I think then we are at the end of our questions. I will address there was a question about multivitamins and nutrition, and we just wanted to let you know there is a workshop Wednesday, May 4th at 2:45 Central Time, the role of nutrition in long-term health after transplant. So that should hopefully answer your questions about that. And with that, I will say thank you so much, Karthik and Bonnie, for the excellent presentation, and thank you for the audience for your excellent questions. Please contact BMT InfoNet if we can help you in any way, and enjoy the rest of the symposium.